There's some major issues going on in Korea. This week, over 10,000 doctors in Korea have resigned. The reason? The Korean government wants to increase the number of medical students. I know, it's so scandalous. The Korean Ministry of Health and Welfare reports that as of February 23rd, 13,000 resident doctors and interns have submitted their resignation and 9,000 of them have walked off their jobs. That's over 80% of all trainee doctors in Korea. So why are all these young doctors so pissed off? What's so bad about increasing the annual medical student admissions cap? At face value, it seems like a win-win for everyone. More doctors to help the public, and more doctors mean a lower workload for the current doctors. Ever since 2006, Korea only admits around 3,000 students a year into medical school, and that number hasn't changed much. But the new president, Yoon Suk-yeol, just announced his new plans to up that amount to 5,000 students in 2025, making medical schools admit 2,000 more students a year, a 67% increase. He says the country is becoming geriatric from the low birth rates, there's not enough doctors in specialties like pediatrics and emergency care, and doctors are complaining about their high workloads. South Korea's doctor-to-patient ratio is already one of the lowest in the world, with 2.1 for every 1,000 people compared to the average of 3.7 people per 1,000 people. There's also a major shortage of doctors in rural areas, with 30% of all cancer patients having to travel to Seoul for treatment, which is why the government wants to add more than 2,000 slots a year to the medical school system to help solve these issues. And 76% of the Korean public does support this initiative. Ironically, the only people who don't support this seems to be the actual doctors. Chosun Daily, a Korean newspaper, did some interviews with the residents to find out why. One radiologist said he resigned because continuing as a trainee doctor would hold little purpose if the expansion of medical schools proceeds. There's no shortage of doctors at present. The issue lies in the lack of trainee doctors willing to work extensively for lower wages and specialists who persevere despite facing legal challenges. While hospitals need to hire more specialists, over-reliance on inexpensive trainee doctors lead to discussions about staffing shortages. The medical system should not be paralyzed simply because trainee doctors resign while still in their learning phase. And he kind of has a point. South Korea has over 140,000 professional doctors, but only 13,000, around 10%, have resigned, and they're mostly interns and residents. Why is there a severe health crisis with hundreds of canceled surgeries when only 10% of doctors are not working? And the staff are just residents and interns. Think early seasons of Grey's Anatomy. They're mostly there to learn and assist, not perform actual surgeries. He goes on to say, some argue that trainee doctors oppose expansion due to financial reasons. However, since medical fees are regulated by law, increasing the number of doctors won't affect these fees. Moreover, if each doctor increases their patient load, it will only hasten the depletion of national health insurance funds projected for 2028. South Korea has universal healthcare, and while it isn't free, it's pretty cheap. A comprehensive health exam with blood work, x-rays, dental, and EKG only runs you around $50 USD, and specialist visits could cost as low as a few dollars. The rest is just billed to the government, which incentivizes doctors to see as many patients as possible. Another doctor interviewed by Chosun Daily, a pediatrician, says, I started to find myself questioning whether to continue along this path. I observed senior colleagues grappling with career decisions due to a lack of clear options. Some were even transitioning to adult medicine, believing pediatric care held no future. News of lawsuits and hefty compensations flooded in, along with tales of intense competition among peers and juniors for other popular department positions. A big problem in Korea is that all the doctors want to get into dermatology and plastic surgery. It's high paying and there's good work-life balance. Plus, national insurance doesn't cover cosmetic surgery, so you can charge whatever you want and there's no cap by the government. This leads to another critique of adding more medical students because people are saying that they're just going to open more dermatology clinics when ignoring the root issue and shortages in other specialties like pediatrics and emergency care. But are doctors striking even ethical? A lot of people on the internet are calling these Korean doctors spoiled, evil, elitist brats who just care about themselves. Some people might even die because of these canceled surgeries. Professor Snowman Kwan, a public health expert at Seoul National University, says, more doctors mean more competition and reduced income for them. That is why they're against the proposal to increase physician supply. And summarizing an opinion from the Blue Roof newsletter, a South Korean political journal, for the past 20 years, the Korea Medical Association has artificially restricted the number of doctors, inducing a shortage to increase profitability. If this is true, then they're actually pretty evil, prioritizing their income over the well-being of the general public. And maybe it's worked, since South Korean doctors lead the OECD in average annual income, making more than 5 times the South Korean per capita GDP, at 200 to 300k USD per year. And over the past 7 years, physician income has outpaced lawyer income by over 4 times. However, Ju So-ho, former president of the Korean Medical Association, claps back, defending their strike, saying, if the government wants doctors to work for the crucial sectors like obstetrics or pediatrics, They should build legal safety nets and increase medical fees first so that the doctors in those sectors wouldn't feel pressured to be sued over accidents or be burdened by heavy workloads. Regardless, it looks like the government is not backing down, issuing a back-to-work order. Those who don't abide face medical license suspension of up to 1 year, a $22,500 USD fine, and up to 3 years in prison. The government says they're going to start prosecuting March 4th. So what are your thoughts? I honestly don't know what to think. At face value, it looks unethical for doctors to be striking, especially after they've taken the Hippocratic Oath. People are dying, missing surgeries because of the walkout. But on the other hand, being a doctor is just another job. If we're being real here, how many doctors actually care about their patients versus just wanting a prestigious job that pays a lot of money? Most of the doctors I've seen in North America are mediocre at best, and I definitely didn't feel like they cared for me as a patient. Doctors, like any other profession, should be able to go on strike for better conditions, just like teachers. But if the doctors in Korea just care about preserving their status and artificially increasing their salaries by creating a shortage, then that's not really defensible. Some people say that this whole thing is just a political ploy by the president, Yoon Suk-yeol, who has an abysmal 20% approval rating, in order to gain support from the public before the April elections. I wish I could read Korean so I could figure out what the Korean public is saying about this whole situation, but let me know what you think. Are the doctors justified to strike, or are they just out of touch and spoiled?